Following the report of one incident of mpox in the state, the Commissioner for Health, Dr. Henry Egbe Ayuk, says the state medical surveillance team has been activated to stem further spread of the disease among citizens. Dr. Ayuk made the disclosure in Calabar while speaking to newsmen on the update and development of mpox in the state. Government House correspondent Sandina brings details.
Dr. Ayuk affirmed that the state prides itself of a strong surveillance team that is proactive to ensure disease outbreaks are identified early and mitigated to avoid spread. He said the index case of monkeypox recorded in Obudu after investigation and preliminary tests was confirmed by the National Reference Laboratory. The commissioner said the ministry has already activated the Emergency Response Operation Center at various local government areas. According to him, the state is currently enlisting contacts and monitors for symptoms, and if manifest, would be managed and isolated at the appropriate center in Obanliko.
It presents classically with maculopapular rash. When I say maculopapular rash, you see things like boils, but they're not actually boils. Raised on the skin, and they're very itchy. Usually spreading from the hands upwards to the rest of the body. And from recent analysis across the world, 70% of the victims are children under 10 years. Classically speaking, therefore, when somebody comes in, when you are looking for mpox and you see somebody with a typical rash on the hands, it is suspect. The armpits will be painful because of lymph nodes that have been enlarged. There will be fever, and the fever is not necessarily because of the mpox. Most of the people that have mpox have already been compromised in terms of their immune levels.
The health commissioner maintained that monkeypox, which is a viral zoonotic infection which is transmitted from animal to man and man to man through body fluid and contact with infected person, manifest like boils, rashes, and itching, spreading from the hands to the entire body. He said children from 0 to 10 years are highly prone to the infection, adding that 70% of monkeypox victims are children under the age of 10. To ensure correct preventive infection measures, Dr. Ayuk called on the public to step up their personal hygiene levels and ensure clean environment.
And the result came out on Saturday positive for mpox. So that is the first case we're having in this current outbreak period in Cross River State. Children are the target in this current episode, where 70% of cases are children under 10. So crowded, schools, environment are very important areas to implement prevention measures. Our attitude, therefore, in the current episode, as it has always been, is to ensure that the correct infection prevention control measures are put in place, carry out community education to ensure that children or adults that have the symptoms are reported, notified to the nearest facility.
The state epidemiology, Mrs. Inyang Ekpenyong, said the state is using a multi-sectoral approach of various surveillance teams across the world, communities, local governments, and the state team to ensure rapid response to tame the disease from spreading.
Being able to position response commodities to affected LGS. We are focusing attention in Obudu local government. We are moving commodities, drugs, gloves, masks, everything that we will need to respond to cases that will be identified to Obudu in their health facility, so that when we pick these contacts and we monitor them, and then anybody that begin to show symptoms, we evacuate them from the facility and put them in the isolation center. Then we manage them effectively. So from the LGL, they will now work with the state team, We have the same rapid response team at the state level, and whatever we are doing, when we say disease, if an infection is zoonotic from animal to man, we do it under One Health.